So let's start off with the basics. What is Medicare? Medicare is a federal health insurance program for those that are 65 or older. And in some instances, individuals who are under 65 may qualify as well. They can qualify if they have disabilities like ALS, also known as Lou Gehrig's disease, anyone with end-stage renal disease, and those who have received 24 full months of disability benefits from Social Security.
Well, thank you, Stephanie. Now, if someone is watching and they say, I'm about to turn 65, what are some of the things that they should keep in mind?
All right, there's a lot of things that we have to keep in mind. In order to be a Medicare recipient, you would need to be eligible for either Social Security benefits or railroad retirement benefits. You must be a U.S. citizen or a permanent legal resident who has lived in the U.S. for at least 5 years, and you are receiving Social Security or have worked long enough to be eligible for those benefits. If you or your spouse are a government employee or retiree who has paid Medicare payroll taxes while working, you also go ahead and qualify.
Okay. Now, if you've ever heard of Medicare, chances are that you've heard of terms such as Part A, Part B, Part D, and you may be wondering what that's all about. Well, Medicare coverage is divided into categories of coverage known as parts. Each of these parts refers to a different stage of coverage or a different aspect of coverage that you can enroll in based on what you qualify for and what your needs are once you become Medicare eligible. Let's first take an overview of these parts and then we'll discuss them in detail. Let's start with Part A. It's also known as hospital insurance. Part A coverage helps to pay for inpatient hospital care, skilled nursing facility care, home health care, and hospice care. Then you have Part B, also known as medical coverage or doctor insurance. Part B coverage helps to pay for covered doctor services and many other outpatient medical services and supplies. Now, a quick note here is that when you have both Parts A and B, you essentially have what's known as original Medicare. That's true. Or even fee-for-service Medicare. Basically, there are different terms that refer to when you only have Part A and B active. Now, neither Part A or B cover prescription medications, so that's why we have Part D. This is known as prescription drug coverage. Part D coverage helps to pay for those covered prescription medications, and Part D coverage can be purchased separately, or it can be added to original Medicare, or it is usually included in Medicare Advantage plans. And then finally, we have Part C. Part C is known as Medicare Advantage. Medicare Advantage plans are an alternative to Medicare in that they offer coverage through a network of providers such as an HMO or a PPO. Now, although some may not, some Medicare Advantage plans also include coverage for prescription drugs. These are the four main parts of Medicare: Part A, B, C, and D. And then in the next module, we'll look at these parts in detail.